My name is Sarah. I'm a child life specialist at Marquette General Hospital. My job is to make things as easy as possible for kids when they're here. During this video, I'll tell you about the people you'll meet and show you some of the things you'll see when you're coming here for the hospital for surgery.
The first thing you should know is that your mom, dad, grandma, grandpa, or whomever brings you to the hospital will be close by. Let's talk about what happens when you get here. Someone from the hospital will call your mom, dad, or other grown-up to tell them what time to come to the hospital. When we call, we will also ask questions about you and how you're feeling for surgery. You will hear these questions again when you are at the hospital. This helps us to take the very best care of you. When we call, we will also remind you that it is very important to have an empty stomach before your surgery. That means you cannot have anything to eat or even drink. That means even water or gum. So remember, when you brush your teeth, be careful not to swallow any toothpaste or water. The night before your surgery, take a bath or shower before you go to bed. If you are wearing nail polish, it is a good idea to remove it before you come to the hospital. After a good night's sleep, you will come to Marquette General Hospital. Remember to pack your favorite blanket, stuffed animal, or book. You will start on the 5th floor. You and the grown-up you are with will start by getting registered. The grown-up you are with will get a bracelet that says your name on it. You will get one too. This will let everyone know your name and who your doctor is. After checking in, you and the grown-ups you are with will wait in the waiting room. There are books to look at and toys to play with. There is also a TV to watch. When it is your turn, your first job will be to get ready for surgery. A nurse will talk to you and the grown-ups you are with. The nurse will also check to see how your body is working. The nurse will check to see how much you weigh and how tall you are. Check your temperature and listen to your heartbeat. The nurse will also check your oxygen. You might hear this called pulse ox. The nurse will check this a few times while you are here for surgery. Sometimes it looks like a little bed for your finger, with something soft for your finger to rest in, and sometimes it is a sticker that goes on your finger like a Band-Aid. The nurse will also check your blood pressure. This will give your arm a little hug. You will be asked to wear hospital pajamas. You will wear pajamas for your surgery and put your clothes back on before you go home. If you have any questions about your surgery, are wondering anything about how the day is going to go, or would like to practice a few things before your surgery starts, remember, the child life specialist's job is to make things as easy as possible while you are here. She will talk to you about your surgery, show you things, and answer any questions you have. When the nurse is done helping you get ready and checking how your body is working, you and the grown-up you are with will go to another room. You might hear this room called the holding room. It is where you will meet the team that will be helping take care of you during your surgery. Your team will include your surgeon, and their job is to do your surgery. He or she will meet with you and the grown-up you are with to talk about what is going to happen. When everyone on your team is done talking to you and the grown-up you are with, it will be time for your surgery. You will say, "See you later," to the grown-up you are with, and it will be time to go across the hall to the surgery room, or operating room, or OR, the room where you will have your surgery. The grown-up you are with will be waiting just down the hall in the waiting room. They will always be close by. When you go to the surgery room, you can take the blanket, stuffed animal, or book you brought with you. The team of people you met will all be with you. The surgery room looks like this. There is a bed just for you. There are computers in that room. Some computers are for the nurses to put in information about you and your surgery. Some computers are monitors that tell us how you are breathing and how your heart is beating while you are taking your special nap. The doctors and nurses will have paper masks covering their nose and mouth and will be wearing hats. This helps keep the room clean and protect you from germs. Everyone will be wearing scrubs or hospital clothes. Your first job when you are in the surgery room will be to do a few of the things you have already done. The nurses will check to see how your body is working. You will have a sticker or little bed on your finger or toe so we can check your oxygen, the hug on your arm or blood pressure, and stickers by your heart so we can watch your heart beating while you are sleeping. When the nurse is done putting stickers on, it will be time for you to fall asleep or take your special nap.
Hi, my name's Grady. I'm a nurse anesthetist, or a sleep medicine nurse. I'll be part of your anesthesia team today. When the nurse is done getting the stickers hooked up, it will be time for you to go to sleep or take your special nap. Your anesthesia team, or nap medicine doctors, will give you medicine to help you fall asleep. You don't have to try to fall asleep. It's a very different kind of sleep than the sleep you have at home. It's a very deep, very peaceful sleep, and you won't feel anything when you're asleep like this. The nap medicine isn't a medicine that you drink. It's a medicine that you breathe through a mask like this. The mask goes over your nose and over your mouth. It feels soft and squishy. You can still breathe, and you can still talk when you have the mask on. The mask will be connected to a tube and then to a balloon. The nap medicine doctor may ask you to blow up the balloon. When you take a deep breath and blow into the mask, the balloon will get bigger. When you breathe in the nap medicine and you go off to sleep. Sometimes the medicine smells a little stinky, like what you might smell when you get on a school bus or when you ride on an airplane. If you smell the stinky smell, it's okay and it's normal. A good thing to do is take a deep breath and blow the stinky smell away. Your job will be to take deep breaths, and remember, you don't have to try to fall asleep. The medicine will do that for you. Try to think about a relaxing thought, or maybe your favorite place, or a trip that you've been on, or something that you like to do. After a few breaths, your eyes will get tired and you will fall asleep. For older kids, it's sometimes safer for them to fall asleep with an IV. An IV is a soft, bendy straw that slides into your best vein, or a little blue line on the back of your hand. The nap medicine doctors will figure out if this is the safest way for you to go to sleep.
When your surgery is done, the nap medicine team will stop giving you medicine and will help you wake up. You will be in the wake-up room or recovery room. In the wake-up room, there will be a nurse taking care of you. The nurse will be checking your oxygen, your temperature, listening to your heart, and asking you how you feel. It is normal to feel sleepy in this room. Your job in this room is to rest and even sleep if you feel like you need to. In the wake-up room, you will see a few things you might not have seen before. One thing you will see is a little blue tube that blows air by you. The tube does not touch you, but you may see it. This air helps you wake up. Another thing you will see in the wake-up room is a drink for your body. Remember, you are going to feel sleepy and your body will be waking up slowly. It is a good idea not to wake up and start drinking really fast because your belly will be waking up slowly too. We do not want you to get a sick belly. The kind of drink you will have is called an IV. We talked about an IV earlier. Some older kids might go to sleep with an IV instead of a mask. An IV is a small, bendy straw that gives your body a drink. This kind of straw does not go in your mouth. This small, bendy straw slides into your best blue line or vein. The nap medicine doctor will slide the straw in when you are sleeping. You will not feel it, it will not hurt you, and you will not even know when they do it. You will see the straw when you wake up. It will be taped to your skin. When you feel like you are waking up and feeling okay, and the nurse says it's okay, it will be time to go to the next room. This room is on the 5th floor where you started your day. The grown-up that brought you to the hospital will meet you in this room. You will be feeling sleepy from the medicine, so the best choice is not to walk. Someone from the hospital will push you on a bed. If you are 4 years old or younger, you will be pushed in a crib. This is to keep you safe. A nurse will ask how you are doing, check how your body is working again, and talk to the grown-up with you about how to care for you when you go home. If you feel thirsty and the nurse says it is okay, you can have something to drink like juice or water or a popsicle. When the nurse is sure you are feeling okay, she will take the tape off your skin and slide out your IV. Then you will get a Band-Aid. You will get to put your clothes back on, and it will be time for you and the grown-up you are with to go home.
Thanks for taking time to learn about the hospital. If you have any questions about coming to the hospital or your surgery, ask the grown-up you're with, or just ask. We want you to have the best day possible while you're here. There are books about coming to the hospital or your surgery. They're listed on our hospital's website. Thanks for taking time to watch our video. We look forward to meeting you.